Breastfeeding is a natural and beautiful way for mothers to nourish and bond with their babies. However, there are many myths and misconceptions surrounding breastfeeding that can make it seem intimidating or even impossible for some women. Today, I want to debunk some of the most common breastfeeding myths and provide you with the facts you need to feel confident and empowered in your breastfeeding journey. Myth number 1. Breastfeeding is painful. While it is true that some women may experience discomfort or even pain while breastfeeding, it is not a normal or necessary part of the process. In fact, breastfeeding should not be painful at all if the baby is latched on correctly. If you are experiencing pain while breastfeeding, it is important to seek help from a lactation consultant or other breastfeeding support professional to address the issue and ensure a comfortable and successful breastfeeding experience. Myth number 2. Breastfeeding is not as good as formula feeding. This myth is simply not true. Breast milk is the perfect food for babies, providing them with all the nutrients and antibodies they need to thrive and grow. Breastfeeding has been shown to have numerous benefits for both babies and mothers, including reducing the risk of infections, allergies, and chronic diseases in babies, and lowering the risk of breast and ovarian cancer in mothers. While formula feeding can be a good alternative for some families, breast milk is the gold standard when it comes to infant nutrition. Myth number 3. Breastfeeding will make your breasts sag. Many women worry that breastfeeding will cause their breasts to lose their shape and firmness. However, the truth is that pregnancy, not breastfeeding, is what causes changes in breast size and shape. During pregnancy, the ligaments that support the breasts stretch and the breast tissue increases in size, leading to changes in the appearance of the breasts. While breastfeeding may cause some temporary changes in the size and shape of the breasts, these changes are usually minor and will not affect the overall appearance of the breasts in the long term. Myth number 4. You need to eat a special diet while breastfeeding. While it is important to eat a healthy and balanced diet while breastfeeding, you do not need to follow a special or restrictive diet in order to produce nutritious breast milk. In fact, most women can continue to eat the same foods they enjoyed before pregnancy while breastfeeding. It is important to stay hydrated and eat a variety of foods to ensure that you are getting all the nutrients you need to support your own health and the health of your baby. If you have concerns about your diet while breastfeeding, it is a good idea to speak with a healthcare provider or a lactation consultant for personalized advice. Myth number 5. You cannot breastfeed if you have small breasts. Breast size has no impact on a woman's ability to breastfeed. The size of a woman's breasts is determined by the amount of fatty tissue they contain, while the ability to produce milk is determined by the mammary glands within the breast. Women with small breasts are just as capable of producing an adequate milk supply as women with larger breasts. The key to successful breastfeeding is proper latch and positioning, not breast size. Myth number 6. You cannot breastfeed if you have had breast surgery. While breast surgery, such as breast augmentation or reduction, can sometimes affect a woman's ability to breastfeed, many women who have had breast surgery are still able to breastfeed successfully. The extent to which breast surgery may impact breastfeeding depends on the type of surgery performed and the individual woman's anatomy. If you have had breast surgery and are interested in breastfeeding, it is a good idea to speak with a lactation consultant or other breastfeeding support professional to discuss your options and develop a plan for breastfeeding success. Myth number 7. You cannot breastfeed if you are taking medication. While some medications can pass into breast milk and potentially affect a nursing baby, many medications are safe to take while breastfeeding. It is important to speak with a healthcare provider before taking any medication while breastfeeding to ensure that it is safe for both you and your baby. In many cases, healthcare providers can recommend alternative medications that are safe to take while breastfeeding or provide guidance on how to minimize any potential risks associated with medication use while breastfeeding. Myth number 8. You cannot breastfeed if you return to work. Many women worry that they will not be able to continue breastfeeding if they return to work. However, with proper planning and support, it is possible to successfully breastfeed while working outside the home. Many workplaces offer accommodations for breastfeeding mothers, such as designated pumping rooms and flexible break times for pumping. Additionally, many women find that they are able to continue breastfeeding by pumping breast milk while at work and nursing their baby when they are together. With support from employers, coworkers, and family members, it is possible to continue breastfeeding while working outside the home. Myth number 9. You cannot breastfeed if you have twins or multiples. While breastfeeding twins or multiples can present unique challenges, it is entirely possible to breastfeed more than one baby at a time. Many women successfully breastfeed twins or multiples by using a combination of breastfeeding, pumping, and supplementing with formula if needed. With support from a healthcare provider, a lactation consultant, and other breastfeeding support professionals, it is possible to establish and maintain a successful breastfeeding relationship with twins or multiples. Myth number 10. You cannot breastfeed if you have a low milk supply. Many women worry that they have a low milk supply and will not be able to produce enough milk to meet their baby's needs. However, low milk supply is actually quite rare and is often the result of incorrect breastfeeding techniques or other factors that can be addressed with proper support and guidance. If you are concerned about your milk supply, it is important to seek help from a lactation consultant or other breastfeeding support professional to identify the underlying cause of the issue and develop a plan to increase your milk supply. With the right support and guidance, most women are able to establish and maintain an adequate milk supply for their baby. In conclusion, breastfeeding is a natural and beneficial way for mothers to nourish and bond with their babies. By debunking common breastfeeding myths and providing accurate information and support, we can empower women to feel confident and successful in their breastfeeding journey. If you have questions or concerns about breastfeeding, it is important to seek help from a healthcare provider, a lactation consultant, or other breastfeeding support professional to address the issue and ensure a positive breastfeeding experience for both you and your baby. Remember, you are not alone in your breastfeeding journey, and there are resources and support available to help you every step of the way.